One of my biggest beefs with orthopedic care is the misunderstanding of referred pain. And I think that we're misconstruing this referred pain and calling them diagnoses like patellofemoral pain syndrome, IT band syndrome, greater trochanteric pain syndrome, subacromial impingement syndrome, and FAI or femoroacetabular impingement syndrome. Those 5 diagnoses I call the biggest stories in orthopedics. I don't find those to be the case. I know they're usually manifested around certain muscles becoming tight and other muscles becoming deactivated. Sometimes there's a bony problem, something a misshapen acromion, or a cam or pincer problem in the hip. Yes, anatomical problems can exist, but these stories of how these diagnoses exist, I don't think hold much water, and they're not what I'm finding with patients. Instead, in almost all situations, I'm finding what I would call a joint derangement, a joint misbehaving and sending pain into these referral patterns. And to give you an idea of how I've come to understand this by learning MDT and by working with thousands of patients and having been diagnosed with IT band syndrome myself in my early 20s, this book helps elucidate that a bit. So this is the newest 2023 edition of this book about the lumbar spine, and you can clearly see the referral pattern of the L4, L5, and S1 dermatomes, which means the part of the body's, the sensation that's controlled by those nerves. So when those nerves can get somewhat irritated, the referral pattern for where they send sensation is clear. And this is not new to 2023. Of course, we've known about dermatomes for a long, long time. I've learned about them in school, for example, but I think clinicians are forgetting them, and they're not equipped with the idea of repeated movement testing to really see, is something in the spine not moving well? Is something in the shoulder, hip, or knee not moving well and sending pain to the lateral thigh? These referral patterns of the lumbar spine, L4, L5, and S1, the lower lumbosacral spine, cover the lateral hip, the lateral thigh, and the knee, among other areas. And so I really refuse to kind of buy into these 5 big stories, and instead I'm looking for a joint derangement, a joint problem that can be fixed with directional preference. And if it's not that, I'm looking for something else, but I'm not buying into these 5 big orthopedic stories.